Okay, so the next subject we are going to talk will be the orthopedics. So as you all know, orthopedics is also a very small subject. So you'll be getting previously there were around 10 questions that was appearing from both orthopedics and anesthesia, 10 each. But recently the number of questions have reduced. So roughly around 5 or 6 or 7, 5 to 7 something you'll be getting from orthopedics. So just knowing the key facts, key points about orthopedics would help you easily crack those MCQs. So what we are going to do is quickly see what are all needed for the MCQs, just the MCQ oriented points. So the discussion is needed for surgery where you could get a lot of cases, but in orthopedics, it's almost always, it's a direct MCQs and which you can easily sort out. So what I'm going to do is in all the topics, I'm just going to tell you what is essential for you to crack the MCQs. Okay, so we'll start now. The first point in orthopedics is the father of orthopedics is Nicholas Andrew. Father of modern orthopedics is Robert Jones. This was a very old patent question, something before 2015. After that, this question did not appear. So you can just see this once, and I don't think so you will need a repetition of memorization in this. Then these are some list of tests that we'll be seeing for orthopedics. So I'm not going to talk about it now, but because we have to go further for during discussion, these tests will come anyway. So only 2 points I will say in this thing that recently appeared. One was this bilateral Trendelenburg test, that is for the waddling gait. Another is this Finkelstein test, that is for DQ1 tenosynovitis. These two appeared in recent patents. Otherwise, the others are also important, but these two appear in recent patents. So I hope you must know these things. Okay. Yeah. So then the next is appearances. So these appearances are very important for your orthopedics MCQ. So the first one is sun ray appearance. Sun ray appearance is osteosarcoma. So I want you to remember it like a sun ray. So imagine this is a sun. This is sun rays. As long as I can draw, this is sun rays. So you have to remember osteosarcoma. So sun is S. I just put a S here. It looks like a O. So it is osteosarcoma. Sun ray appearance is osteosarcoma. Then comes soap bubble appearance, that is GCT. So soap bubbles look like this, small bubbles. I want you to just elongate it and make a G. So GCT, you must remember GCT. Soap bubble appearance, GCT. Next is onion peel appearance, that is Ewing sarcoma. Onion peel appearance, that is Ewing sarcoma. So if you cut and open an onion, the onion would look like this. You cut and open an onion, the onion would look like somewhat like this. So this will be the rootus. So cut and open, if you can see, it looks like a E on the above. It looks like a E. So you must remember onion peel appearances Ewing sarcoma. Onion peel appearances Ewing sarcoma. Onion peel appearance Ewing sarcoma. Never forget it. Okay. It can also be chronic osteomyelitis, but most of the time it is Ewing sarcoma. So commonly if they ask what is onion peel appearance, you have to say it is Ewing sarcoma. So these are the first three mnemonics, pictorial mnemonics I'm presenting you here so that you can easily remember these 3 points. So when you remember them by pictures, I don't think so you will ever have to review them again. Okay. Then the next is some signs and lesions. So they're called eponyms. So first is Brody's abscess, which is subacute osteomyelitis in upper end of tibia. Next is Terry Thomas sign. There is scaphoid lunate dislocation. Then Bancott's lesion, anterior glenoid labrum. Hill-Sachs lesion in humerus head. Kilo-Nevi sign in anterior interosseous nerve injury. So in this point, I want you to focus more and more on Bancott lesion, which is anterior glenoid labrum, and Hill-Sachs lesion is humerus head. because all of them, all 5 points are important, but this is the most highly repeated in them. Bangkot anterior glenoid. You can remember it with the name BAG. Bangkot anterior glenoid. Bangkot anterior glenoid. BAG, BAG. And Hill-Sack lesion is humerus head. You can remember by the name Triple H. Triple H is a famous wrestler. He's one of the most, he's almost the most popular wrestler ever. So Bangkot and Triple H. Triple H is for wrestler. So Hill-Sack humerus head. So this Triple H, if you see, he will have a hammer in his hand. So it is hand is humerus. So Hill-Sack humerus head. Hill-Sack humerus head. Okay. So these two are must if you memorize in this table. The next is the 3-point relationship at elbow. So this relationship should be maintained for a stable elbow. So there is medial condyle of humerus, lateral condyle of humerus, lateral epicondyle of humerus, medial epicondyle of humerus, and the tip of olecranon. If this is broken, then there's going to be a dislocation. Medial epicondyle humerus, lateral epicondyle humerus, and tip of olecranon. 3-point relationship at elbow, very important. The next one is about the joint. The key points that you need to know is the golfer's elbow, student's elbow, and tennis elbow. This is about the elbow joint. So golfer's elbow is for medial epicondylitis, tennis elbow is for lateral epicondylitis, and student's elbow is for olecranon bursitis. So you're going to remember them. So imagine a tennis player who is hitting a, he's holding a bat like this while he's playing. While he's holding a tennis bat and playing. So tennis elbow, you have to remember this lateral part is going to be destroyed in tennis elbow. Tennis elbow, lateral epicondylitis. Okay. When a person is playing a golf, his hand would be very straight holding the golf stick. Holding a golf stick. So the medial portion, so the hand is very medial towards his body. So the medial portion is going to get affected when he is playing golf. Golfer's elbow, you need to remember medial epicondylitis. It might look silly, but this picture must definitely help you in your exam. Very easily you can identify, because when they ask tennis elbow and they provide lateral epicondylitis, medial epicondylitis, you are definitely going to get confused in that point. So if you remember just this picture, easily you can crack this. Next is student's elbow, olecranon bursitis. Okay, then that's it about the elbow. Then the two important points are housemaid knee and clergyman knee. Housemaid knee is prepatellar bursitis, clergyman knee is infrapatellar bursitis. Clergyman knee is infrapatellar bursitis. Housemaid, prepatellar, clergyman knee, infrapatellar bursitis. This you will have to memorize. Next is some points regarding this fracture. The commonest fracture that can ever happen is the clavicle fracture. The commonest fracture that can happen at birth is still the clavicle fracture. The commonest carpal bone fracture is going to be the scaphoid fracture. The commonest humerus fracture, the commonest nerve affected is going to be the radial nerve. In supracondyle humerus means anterior interosseous nerve, AIN. Elbow fracture means brachial artery. Knee fracture means popliteal artery. Most common fracture at face is going to be nasal bone. So commonest fracture, if you see, in face it is nasal bone, in carpal bone it is scaphoid, and most commonly it is clavicle. Most common fracture is going to be clavicle. So these are the points you must memorize no matter what. Then comes the stress fracture or march fracture. This is where we are talking about second metatarsal neck fracture. This definitely you should expect a image based MCQ. So they might provide you a radiologic image. They might talk about a lot of stress that is happening in the legs, and then patient they might show a x-ray where the second metatarsal neck is broken. So they might ask what is the diagnosis. Answer should be stress fracture or march fracture. Okay, so the patient will have abnormal motility. So next is fracture having malunion and fracture having non-union. So what are the fractures that are having malunion? Or humerus supracondyle fracture, femur intratrochanteric fracture, and clavicle fracture, Colles fracture. So malunion fractures are SIC. SIC. S is for supracondyle, I is for intratrochanteric of femur, C is for clavicle and Colles. SIC. Non-union or humerus lateral condyle, femur, neck, ulna, tibia, talus, and scaphoid. So if you remember SIC for malunion, you should know whatever that not comes here, it is going to be non-union. So directly they will be giving you what are the fractures of malunion. They might provide you the list from here, and they might provide one list from here. So out of these two, at least one you must remember. Try to remember from malunion. So malunion, SIC. S is for supracondyle fracture, I is for intratrochanteric fracture, C is for clavicle and Colles fracture. Just remember, scaphoid is not a malunion. Scaphoid is a non-union fracture. The next is dislocation. In dislocation, the commonest dislocation is shoulder in the anterior perspective, and then the most common dislocation that is happening in a child is going to be the elbow dislocation, because the parents would be swinging the child with their hands, so the elbow could get dislocated commonly. So if the hip is dislocated, sciatic nerve is injured. If the knee is dislocated, common peroneal nerve is injured. If the elbow is dislocated, ulnar nerve is injured. And if the wrist is dislocated, median nerve is injured. These are very important. Hip, sciatic, knee, common peroneal, elbow, ulnar, wrist, median. So in which first I want you to remember W, wrist for M, just in a reverse way. Wrist is median. So if you remember wrist median, you would remember easily elbow is going to be ulnar. If wrist is median, elbow is going to be ulnar. So hip is sciatic, knee is common peroneal nerve. Okay. So knee, I want you to remember popliteal fossa is present in the knee. So P for popliteal fossa, P for peroneal nerve. P for popliteal fossa, P for peroneal nerve. Hip, you have to remember sacrum is present in the hip area. So S for sacrum, S for sciatic nerve. S for sacrum, S for sciatic nerve. So elbow, by the chance of exclusion, elbow is going to be ulnar nerve. Am I clear here? Yes, very good. Next, here are some conditions and their treatments. So Colles fracture means handshaking cast is used. Scaphoid fracture, glass holding cast. Compartment syndrome, you are going to do fasciotomy. Elbow, pulled elbow means forceful supination, and intratrochanteric fracture of femur means dynamic hip screw. So you're going to get a case here. You're going to get a case. Colles fracture, okay, fine. Colles fracture is there. You might get a case of RTA, road traffic accident. Scaphoid could be a fall with stretched hand. And then compartment syndrome means some heavy object fall over the patient's leg. So when heavy object falls over the patient leg, the blood supply to that area is going to get cut off. So the patient is going to get a lot of compression over here. The area is going to die sooner. So to save the dying muscles, you will have to do a fasciotomy. You have to release the muscle compartment. That is very essential. So fasciotomy. Then comes the pulled elbow. So if they have to tell you that this condition is pulled elbow happens in children who are playing with their fathers. So the father would probably swing the child in their hand, and then the elbow will get pulled up. So that is pulled elbow. Just turning the hand in a supination way is enough. That is forceful supination. This usually happens when the child is taken for an X-ray. So when the X-ray has to be done in the hand of the child, so the elbow will be supinated just for taking the X-ray. At that moment itself, it will get corrected. So forceful supination gets corrected by is the way of correcting the pulled elbow. Next is intertrochanteric fracture of femur. So when they're talking about femur fracture, most probably they will talk about a fall. They'll talk about elderly women or a man, elderly person who is having a fall, most probably at the age of around 60 to 70 years. So intertrochanteric fracture of femur means dynamic hip screw will be needed for the patient to get fixed. Okay, so what you need to know, whenever there is femur fracture, the patient is at risk of fat emboli. The patient is at risk of fat emboli. So this fat emboli occurs within 48 hours. Within 48 hours. So F, you need to remember F, and F. So 3F you have to remember for 3F you have to remember for fracture of femur. The first F stands for fat emboli. The next F stands for 48 hours. The third F stands for fixation, hip screw fixation, dynamic hip screw fixation. So 3F you must remember in this. Fat emboli, femur, fat emboli, 48 hours fixation. Femur, fat emboli, 48 hours fixation. So when the femur neck is fractured, if the patient is less than 65 years, you're going to do screw fixation. But if the age is more than 65, that's why I said 60 to 70 is the age. If the age is more than 65, you're going to do hemiarthroplasty. That's very important. But the patient already had a fracture, so it's an old fracture, means there's an old fracture in that area, means Marrow osteotomy. That's what you're going to do, Marrow osteotomy. So this is very important. So definitely they will give you a high energy trauma in the point as clue that this is forceful accident. Then the next one is CTEV, congenital talipoequinovarus. This is also called as clubfoot or rocker bottom foot. So this is a condition where the child presents with their feet pointed downwards and towards inside. So downwards and towards inside. This is how the feet will be for the child. So this is how the feet will be for the child, downwards and towards inside. So this is called as rocker bottom foot. So this could be postural, this could be structural. So postural means there is going to be a muscle imbalance. Structural means bones and joints are affected. So muscle or bones can be affected. When muscle is affected, it is postural. When joints or bones are affected, it is structural. So PM and BS, postural muscle, BS is bone structural. Okay, so at birth, the treatment would be casting. At 1 to 3 years, the treatment would be soft tissue release. At more than 10 years, the treatment would be triple arthrodesis. So if they have to tell you the CTEV, they will definitely provide you a picture. Almost all the time they ask CTEV, there was a picture in that question. Next is gunstock deformity. So regarding gunstock deformity, all you need to know is when the forearm is extended and deviated towards the midline of the body, this occurs. Extended forearm leads to gunstock deformity. Okay, so I want you to remember this by when you shoot in a gun, the bullet is firing. So firing bullet expands outside. So it causes explosion. You can remember by it causing explosion. The fired bullet causes an explosion here. There's an explosion here. So gun means you have to remember explosion. So you have to remember explosion plus fire, explosion, fire. So extended forearm. You need to remember gun stock deformity, extended forearm. It might look silly, but it is very important for your MCQ. Extended forearm, expansion fire, gun expansion fire, or gun explosion fire. So you have to remember extended forearm for a gun stock deformity. So this is supracondylar fracture, supracondylar fracture. So treatment is going to be close reduction and K fixation. Treatment is going to be close reduction and K wire fixation. Next is osteoarthritis. So osteoarthritis can involve either DIP or PIP. So DIP means it's called Heberden node. PIP means it's called Bouchard node. So in a young patient, you would do a high tibial osteotomy. In an old patient, you will do total knee replacement. This is the point you need to know. Young patient, high tibial osteotomy. Old patient, total knee replacement. DIP means Heberden node. PIP means Bouchard node. The joints, DIP and PIP joints. Next is osteoporosis. So osteoporosis means decreased bone mass. Osteoporosis means decreased bone mass. So osteopetrosis is also condition like that. So the defect in osteoclastic resorption of immature bone. So slowly, patient will get osteoporosis. So decreased bone mass. So he's at a high risk of getting a fracture. So this patient, if you check the BAP, bone alkaline phosphatase, that's going to be elevated, and he's going to have a codfish vertebra. So because vertebra is the most common bone to get fractured. But if you check the serum alkaline phosphatase, it is going to be normal. That is very important MCQ. Serum alkaline phosphatase is normal in an osteoporosis patient. I repeat the key points. The key points are bone alkaline phosphatase is elevated, but serum alkaline phosphatase is normal. That is what is going to tell you that you are dealing with osteoporosis patient. Okay. So one time asked MCQ regarding the drugs causing osteoporosis was lithium. Lithium was asked. Lithium is a drug that causes osteoporosis. So it's better to know all the drugs regarding osteoporosis. They are warfarin, lithium, PPI and glucocorticoids. Warfarin, lithium, PPI and glucocorticoids. Okay. So that's it about osteoporosis. The next is the Paget's. So Paget's means you have to remember So Paget's means you have to remember P for Paget's, P for pelvis, P for pain, P for pre-malignant, P for pre-malignant, P for phosphate, P for alkaline phosphatase, P for alkaline phosphatase, phosphate phosphatase. Then C for calcium, C for cotton wool, C for cotton wool skull, and C for calcitonin. Cotton wool skull, calcitonin. I repeat, you have 6 P's here: pelvis, pain, pre-malignant, phosphate, phosphatase, that is alkaline phosphatase. Okay, so the last P is for Paget's. So Paget's will have this many P's. And C is for cotton wool skull, C is for calcitonin, C is for calcium. Along with that, one more P I want you to remember, that is phosphonate, that is bisphosphonate. So only you need to remember P and C when you read this Paget's. That's it. If you remember this, the entire point is done. Am I clear here? Yes, very good. Next is osteopetrosis. So osteopetrosis means marble bone disease. Cranial nerve 2, 7 and 8 are affected. Osteoclast deficiency will be there. So treatment is bone marrow transplantation. So this is an osteoclastic resorption state of immature bone. So the bone is not matured because of the osteoclastic problem. So labs will show pancytopenia, and hepatosplenomegaly will be there. Hepatosplenomegaly will be there. Okay, so osteopetrosis means I want you to remember marble bone, cranial nerve 278, and osteoclast deficiency. These three words are very, very important. So I want you to remember CM278. This should be the mnemonic for osteopetrosis. So CM278. So C stands for clast deficiency, osteoclast deficiency. M stands for either metabolic bone disease or a marble bone disease. Metabolic or a marble bone disease. 278 stands for cranial nerves. CM278. CM278. Okay, and CM278 and BM. CM-BM278. BM stands for bone marrow transplant. BM stands for bone marrow transplant. Then you are going to remember HM, that is hepatomegaly. HM, that is hepatomegaly. Then you are going to remember SM, that is splenomegaly. Splenomegaly, hepatomegaly, splenomegaly. BM is bone marrow transplantation. Bone marrow transplantation. So CM, BM, CM, HM, SM 278. CM, BM, HM, SM 278. I hope this will be very, very helpful for you. So osteopetrosis. Osteopetrosis means you have to remember CM, BM, SM, HM 278. Okay. Next is achondroplasia. Achondroplasia means it's a disorder of bone growth that prevents the change of cartilage, particularly in long bones. Okay, so cartilage becoming a bone, that will be stopped. So I want you to remember, you know, the ABC. I want you to remember it as ACB. So cartilage becoming bone is stopped. ACB. Instead of ABC, I want you to remember it as ACB. ACB. Okay. Now, A, C, B, D, E. This is what you are going to remember for achondroplasia. A is for achondroplasia. CB is for cartilage becoming a bone is blocked. Cartilage becoming a bone is blocked. D is for dwarf. Dwarf limb. The IQ is normal. You have to remember, if you've seen a movie called Apurva Sagodharargal that is made by Kamal Hassan, he would have acted like a dwarf circus man. He would have acted like a dwarf circus man, but he will have enormous IQ. That is achondroplasia. And E stands for enchondral ossification defect. E is enchondral ossification defect. So who is Kamal Hassan? He is a star. So starfish hand. So Kamal Hassan is a star. You have to remember ACBDE. So if you remember that character Appu, the name of the character is Appu. If you remember that character, you will remember ACBDE, that is achondroplasia. Am I clear here? He's a star, so it's a starfish hand. He is very brilliant, so IQ is normal or even above normal. Limb is dwarf. Okay. Next. Ankylosing spondylitis. We already talked about it when we read up. 1 second. charge. Yeah, sorry for the interruption. So regarding ankylosing spondylitis, you must know it's HLA-B27 positive. Sacroiliac joints are involved. Bamboo spine is seen. It is a form of arthritis that primarily affects the spine. Specifically, the sacroiliac joint is affected. So there's an inflammation of vertebra. This leads to severe chronic pain and discomfort. So ankylosing spondylitis means the patient will have ankylosing spondylitis means you need to remember the patient's spine is affected. So straightening of spine is seen. There is bamboo spine. The patient's eye is affected. Uveitis, anterior uveitis, ankylosing spondylitis means anterior uveitis, and B27, HLA B27, HLA B27. Okay, so ankylosing spondylitis means I want you to remember A, B, C spine. A, B, C spine. A, B, C spine. Where A is for anterior uveitis, A is for anterior uveitis, B is for bamboo spine and B27, HLA B27, and C is for chronic pain, and spine is for spine. The pain is in the spine affects specifically S means sacroiliac joint. S means sacroiliac joint. So ABC spine is the mnemonic you are going to remember for ankylosing spondylitis. Okay. Then the next is scurvy and rickets. So scurvy is vitamin C deficiency, rickets is vitamin D deficiency. So in scurvy, you're going to treat the patient with vitamin C. In rickets, you're going to treat the patient with vitamin D. So all you need to remember is the different appearances that you're going to see in the X-ray. In scurvy, you're going to see something called the Frenkel line, ground glass appearance, and a Wimberger ring sign. In rickets, you're going to see rachitic rosary, Harrison groove, bow legs, knock knee, wind swipe deformity, cupping, splaying, fraying. So these are all the visual parts that you need to see. So I ask you that you have to go through the pictures of scurvy and rickets in the internet as much as possible. Look at the X-rays of them, because definitely it's a multiple time asked question and highly important question. The next is TB. So TB, we have already talked about TB. So only one point regarding TB here is the TB bones. So when it affects the bones, you need to know TB spine is the most commonly affected part, that is spot spine. So after spine, it's going to be the hip. So first is going to be the spine, after spine is going to be the hip. So when it affects the hip, it's called as wandering acetabulum. Wandering acetabulum, it causes wandering acetabulum. So the first symptom is going to be the stiffness of the hip. So the patient will start limping. Okay, so in spine, it is going to affect the dorsolumbar region. So first is spine. Second is hip. Then comes either knee or elbow or shoulder. Or finally digits. Knee, elbow, shoulder, and digits. So when it involves the knee, it causes triple deformity in the knee. When it involves the elbow, you have to know elbow is one of the most common sites which is affected. TB elbow. Then when it involves the shoulder, it causes something called caries sicca. When it involves the digits, it causes something called spina ventosa. It is called as spina ventosa. TB in digits is called as spina ventosa. This is one of the most important MCQ here. TB in digits is called as spina ventosa. Okay. So whenever TB is involved, whenever you get TB, the treatment is going to be anti-TB medications along with rest and surgery. Anti-TB treatment or anti-TB medications along with surgery, with or without surgery. So TB treatment is antibiotics, anti-TB medications. Next is myositis ossificans. So myositis ossificans means, remember, do not touch skeletal lesion. Do not touch skeletal lesion. So there is going to be a history of massage which damaged the muscles of the surrounding a bone because there is already a lesion in that skeletal muscle. So around the joints, there's going to be calcification, which is going to cause extensive pain. So in acute stage, immobilization is helpful in recovery. What you should not do is to strain that area where there is a calcification. So if you strain more, you'll end up in having a surgery. So if first is more than 1 year, surgery should be done. So regarding myositis ossificans, only point you need to know is there's going to be a history of massage and do not touch skeletal lesion. It's a do not touch skeletal lesion. Next is compartment syndrome. We already talked about the compartment syndrome. So compartment syndrome means most probably you'll it's because of application of tight cast, either an accident, like either some heavy object fell on the foot or tight cast application. So the pulse felt normally in the affected limb. There's pain on passive stretch. Treatment is going to be fasciotomy. So compartment syndrome, you have to remember pain on passive stretch and fasciotomy. Next is osteoid osteoma. So osteoid osteoma means you're going to have nagging pain at night relieved by salicylate. It is the most common benign bone tumor. So osteoid osteoma, benign bone tumor, OOBB. That's what I want you to know. And then NN, nagging pain at night, OOBBNN. So osteoid osteoma, benign bone, nagging pain at night, OOBBNN. So if you remember this word, you should be able to crack the MCQ. OOBBNN. Next is Perthes disease. So Perthes disease is because of the sudden cutoff of the blood supply to the head of femur. So this is a temporary problem. So it causes avascular necrosis of the femur head. So avascular necrosis of the femur head. So Perthes disease, you have to remember